on this episode of The Natural Plastic Surgeon. So how often were you getting sick?
Dr. Barrett, it was insane, like all the time. And I remember high school, I would constantly be missing school because I would just come down with anything and everything. Whatever was in the air, I would catch it.
People think that's normal. It's not normal.
Okay, thank you for saying this because people deal with things and it might be common, but there is a difference between common and normal.
Some of these like foods, these cereals, you know, these companies are so far removed from actually caring about people, you know, and so that's why I like your products because it seems like you have a lot of passion behind your product line and you really care. So we're episode 38 of the Natural Plastic Surgeon podcast. We have Siff, who's a patient of ours who just underwent a breast reduction. And so we have her here today on the podcast, and we're excited to kind of talk about before, during, and kind of after now while you're healing about your whole experience. And then also, you're here to also talk about your product line and some of the things that you're focused on, which actually aligns well with some of the things that I promote.
So well.
And this is your company called Arrae. Is that correct?
Yeah.
Okay. And we have one of your bloat products here, which has digestive enzymes in it. I checked it out online actually before, and you actually gave me some here, which I'm really excited to try out because this is really huge. I'm a big believer in digestive enzymes. I take them every day. The more natural, the better. And so I guess why don't we go ahead and tell us a little bit about yourself and what made you come out with this product line, and then you have some questions for me too. So I'm happy to be your guest as well.
I'm Siff. I'm the founder of Arrae and the Dream Bigger podcast, which you're going to be on. And I'm so stoked.
I know.
But essentially started Arrae because I had real issues with my immune system, kind of felt like I wasn't getting what I needed from my Western medicine practitioners essentially, and really got into the world of natural remedies and started experimenting with herbs, minerals, vitamins, started to see huge, long-term changes in my immune system, not just antibiotics after getting a little bit sick. It was, real changes. I wasn't getting sick anymore and started experimenting from there with all the other issues that I had from I was running really anxious. So dealing with that, digestion, which was a big pain point for me, fatigue. And I really saw the power in supplements, which obviously you're a big proponent of as well.
Absolutely.
And wanted to kind of fill this white space that I saw in wellness by creating 100% natural targeted supplements that were fast acting and just really beautiful as well. So women would want to integrate it into their routines because, one issue that we've seen with supplements as well is that people take it, maybe they stuff it to the back of their pantry, forget about it. So we really wanted to make a really chic yet efficacious experience.
Amazing. And so I want to just dive in a little bit deeper on you. You were getting sick a lot. I didn't know that about you. So how often were you getting sick?
Dr. Barrett, it was insane, all the time. And I remember high school, I would constantly be missing school because I would just come down with anything and everything. Whatever was in the air, I would catch it. Flu, cold, cough, just prolonged sicknesses, literally anything that was floating about in the air. And I hit my breaking point actually in my early 20s. I ended up fracturing a rib from a chronic cough. And and I was 22, I think. Yeah. And when I went to my doctor, there was no real long-term game plan. It was more so here's some codeine. And I was okay, but that's today. What do I do afterwards? Right. And there was no plan. And so that's kind of what led me down this path. And so glad I went down that path because it's very powerful.
Well, I want to peek into that just a little bit. I mean, it's just so many rabbit holes we could dive down into.
Oh, yeah.
So it's funny, because I'm a traditionally trained doctor. I went through traditional medical school. There's no focus on nutrition. It is very pharmaceutical heavy. The entire second year of our medical school is basically, here's the chronic disease and here's the pharmaceutical that can mask the symptoms.
Totally.
Right? Very few things actually cure anything. And so it's if you have loss of thyroid function, what is the solution? Oh, we're just going to replace your thyroid hormone with a synthetic thyroid hormone. How about we figure out why our thyroid is being attacked by our immune system versus trying to just create, I mean, I get it. If nothing else works, yeah, we got to have some kind of thyroid hormone, but why don't we get to the root cause of these problems?
That was like the real issue for me, that I just felt that conversation never happened. And thankfully we have gotten to a place where more and more doctors like yourself are like recognizing the power in like more of an integrative approach,
Yeah.
which I am all for, by the way.
Right.
But it's really nice and refreshing to see yourself also have like a supplement protocol during recovery, which
Yes.
for me, like that was really like the thing that I was like, oh my God, like he really gets it.
Yeah, it makes a huge difference. Like we have some digestive enzymes, some bioptimizers that I think work really well. I'm gonna try out your product definitely as well, and I'm open to offering it to our patients as well. But it's funny the difference that the patients, when I first started my practice, when I didn't have supplements afterwards geared towards them, and all the experimentation, everything that I've got to bring on the supplement line that I do for each in particular surgery has been very transformative in terms of people's recovery and their results. And it's a matter of night and day. People are getting back to work sooner. They're feeling better. They're less pain. They're not taking narcotics as much. That I do still prescribe antibiotics a lot of times, which I also did for you, which I don't like to do. But at the same time, we're kind of opening up your body to a possible infection, right? Less so much with breast reduction, which you had, but there's still that chance, and we don't want to run that risk.
Well, but you also recommend probiotics,
right?
And then there's like,
well, not only probiotics but prebiotics,
Yep.
IgY Max, which is a leaky gut guardian, which helps replace bad bacteria with good bacteria. And it's funny, people are like, I still taking the digestive enzymes because I'm not getting any bloating anymore. I take it, and that's the same thing that your product does, is it prevents bloat, right?
Exactly.
So it's just like people think that's normal. It's not normal.
Okay. Thank you for saying this, because people deal with things and it might be common, but there is a difference between common and normal. And my issue is that like things become normalized and they really shouldn't be. We shouldn't be okay with feeling subpar for forevermore.
I know, but it's like having that awareness is missing in so many people. It's like people eat eggs for their breakfast. Like I was eating eggs for my breakfast and I didn't realize my body was sensitive to it. I took a food sensitivity test. I realized I was very sensitive to eggs. So I cut it out of my diet. I felt immediately better. And then I was like, well, why am I sensitive to eggs? And I realized I had a horrible leaky gut. I had like 25 things that I was sensitive to. And then over time, I kind of healed my gut with things like, digestive enzymes like you have, fasting, IgY Max. And I was able to actually restore my gut. Now I got it down to 2 moderate sensitivities and I can eat eggs now. And I don't get that same crappy feeling. I just thought that was normal. I was like, oh, you don't normally feel that way when you have eggs?
Yeah, it's like a constant thing that like people are just, they don't realize that there is a different way, and like you can get better through like different modalities, like different supplements. And I'm so impressed with the fact that like it's part of kind of your practice and how you approach patients. I think it's very refreshing.
Well, I mean, I think my fundamental rule is, how would I want to be treated? Like, do I want to wait long for my appointment? I want to make sure I get a good value for money that I'm paying. I want to be treated with respect. I want people to actually care. If you ever go into a place that like, people really don't have any passion about what they're doing for you, it's just like, they don't really, you're just another cog in the wheel, or they're another cog in the wheel, and you don't get, it's like, at the DMV, you're going to get your driver's license for the first time, and they're just like, next. It's just like, nobody's excited for you.
No.
And I'm not expecting that at the DMV, God knows. But I'm saying, it's just like when you go to a plastic surgery office, I mean, if you buy a supplement, it's like, some of these like foods, these cereals, these companies are so far removed from actually caring about people, and so that's why I like your products, because it seems like you have a lot of passion behind your product line, and you really care. You care about the effectiveness. You care about the health of the people that are actually taking these products. And that's how I feel too, is like, I want to go in, if I'm going to get plastic surgery by somebody, I want somebody who's passionate about it, really cares about the finer details, because there's things I do during surgery that nobody's ever going to know the difference, but I know there's going to make a difference. Right. And so it's like, at the end of the day, I go home and I judge myself. I'm like, look, did I do the best work that I can do today? And that's what I care about.
Like, you really want to change people's lives, right? Like, and I think plastic surgery like does that massively. Like, I see that in myself. Like, I like, now I've just been texting my friends being like, why didn't I do this sooner? Yeah. Like, I wish I had. And like, plastic surgery really has the ability to change lives. And like, I feel the same way about our business as well, that like for me, I'm very like, purpose driven. And I knew that I wasn't someone who was ever going to start a business to start a business. It had to be something that like I really cared about, and like to know that I touch people's lives, and like the emails we get, and like it's the same for you guys, right? Like just constantly like,
Yeah.
you changed my life. And I'm
I
like,
get,
oh
yeah.
my God, that's.
I get I mean, even you telling
Yeah.
me, I mean, and I'm very grateful for you as a patient, and thank you for trusting me with your body, because that's like a most important thing, right? It's like,
Huge.
you know,
Yeah.
you're not going out there buying a car. Of course, you want your car to be safe and whatnot, but like if you don't like the seats, whatever, you trade it in 2 years, right? If you're not happy with like a surgery on your body, it affects you for the rest of your life, you know?
Totally.
So I try to take that seriously. No, I do take that very seriously, and I always remember that when I go into each room, no matter how busy it gets, I'm always just remembering, all right, here's this person's first time, and it goes back to again, like how would I want to be treated, you know, and then I add in a bunch of other stuff like the recovery stuff, the supplement stuff, because we want recovery to be fast. We all busy. We want to get back. We want to heal, right? We want to have less complications, right? And so it's like if I don't support that whole process of the person as a whole, like my surgical outcomes are not going to be as good, and my patient's going to suffer. So
also, I
it all
have to
ties in.
add, when I went through recovery with you guys, I actually, and I know every person is different, every like case is different, but I actually never had to take prescription grade painkillers, and I
Right.
used your CBD oil, which is phenomenal. I
Thank
have
you.
to like call it out, incredible.
Yeah.
And I obviously used magnesium as well, and then
Yes.
like I used Tylenol for the first few days as well, but that's literally all I needed. Like that is wild. And obviously arnica was incredible too. Like it really helped with the inflammation. So
Yeah. So I mean, thank you. So these are products that I've kind of researched, and we've gone through different companies, and they're not. It's not about a profit incentive on any of these. The only one that we've actually gone off and made our own is the CBD right now, because we needed certain specific things that were specific for surgery healing.
yeah.
I need it. Like I don't need CBD that helps you focus, because there's all kinds of blends of CBD, and there's terpenes that you can add to them. And then, you know, having it organic, having it high concentration, and having, I didn't want to have any sweeteners in it. I wanted it all natural, right? So, because that's important to me. I mean, stevia is kind of, you know, they wanted to put stevia in. I was like, no, I was like
You don't even need it.
You don't need it. And so, you know, we came up with that CBD because I just needed something specific for post-surgical pain and helping you sleep afterwards, and not using narcotics, which I think are garbage, by the way. So I'm wonderful I'm glad that hurts. But then there's other products. These are not my products, but I've taken them, I've tested them out, and we do sell them in the office, but it's not really to make money off of these products. It's to provide an endorsed product that we recommend to help you heal. Magnesium, I like BioOptimizers because there's 7 different types of magnesium in there, and you get the most absorption. So it helps with bowel movement after, you know, if you get, you know, constipation from all the anesthesia. It helps with the muscle tightening. It helps with sleep at night. So all those things, that's why we recommended that for you to take.
Yeah, it honestly incredible protocol. I mean, obviously you know, but I recommend you to everyone under the sun who will listen to me.
Thank you.
Like I have people being like, I'm booking my consult. I'm like, go to him. He's the best.
Awesome. Well, wonderful. Well, so I'm a guest on your podcast.
Yes.
Now. Okay.
Let's dive into the questions.
All right. Let's
I'm
go.
so stoked.
Okay.
So I think let's just dive right in and talk about breast reduction and some myths, okay?
Okay.
Because I remember when I was looking into breast reduction, the thing that I kept hearing is that recovery is like truly like the gnarliest process, and it's you're going to be down and out for like months, and like all of these like things, right? So what are some myths around breast reduction specifically that you hear a lot?
So I think that's a myth. I think if you go and you get the right procedure done, and you have a surgeon who does a lot of pre-injection with numbing medicine and uses appropriate surgical technique, you actually will feel relieved when you wake up from surgery. It's one of the few operations where my patients wake up and literally when I'm transferring to the gurney, they feel like a weight's been lifted off their chest. So that's rare. That doesn't really happen with anything else. So that's definitely a myth. Breast reduction should be a very positive procedure immediately. And then not only does it functionally feels good.
Yeah.
Cosmetically, it feels good too. It looks good. You fit into clothes better. It's just like a win-win. They're my happiest patients. I mean, clearly you're like ecstatic, and I love it. You know, and so
all I've been doing is shopping.
Yeah.
Like it's actually problematic.
Right. I know. I mean, it's funny. It's like people come to me. It's not how the body looks naked. It's like what clothes they could fit into.
Yeah.
It's that's what it's all about. And it's not about their husband. It's not about their boyfriend. It's about themselves and what clothes they can fit in. And that's what our society is sometimes. But it's fun. It's great. Life is short, so go for it. But so a couple of the myths with breast reduction is it really depends on the procedure. There's a type of breast reduction procedure that is by far superior than others. The old school way of doing it is this inferior pedicle Weiss pattern. It's an anchor scar.
Yeah.
Have you heard about that?
Yeah.
Okay. I'm pretty sure we talked about it during the
Yes, the first
consultation.
thing. Yeah, I remember.
Yeah, and it uses your skin to hold the breast up, and it's this old school way. It takes the volume out of the side of the breast, so the breast ends up looking flat and boxy, and it looks good on two-dimensional paper that we use during residency. That we learn about it, and everybody learns about it, and that's what majority of doctors do. There is a female doctor up in Canada named Betsy Hull-Finley, over 10 years now, probably like 20 years now. She developed a vertical breast reduction technique, meaning that it only uses an incision around the areola and a line going down. So it's called a lollipop incision, and it combines liposuction with it as well. So you don't get these horizontal components, and it treats the breast as a three-dimensional structure, which is a far superior way to have the breast look. So one of the myths is that if I'm going to get a breast reduction, I'm going to have all these horrible scars. So you don't need that. If you go to the right doctor that does a lollipop or vertical breast reduction technique, you don't need to have those crazy horizontal scars. So make sure that if you're going to get breast reduction, and in no size, doesn't matter, any size can be done, the vertical breast reduction, you want to make sure that your doctor can do that technique. So I went and I learned from her exactly how to do this procedure, and now it's the only thing I do because it's far superior.
What do you do afterwards for scar reduction?
Scar reduction, it starts with your inflammatory state in your body. Okay. So I want people to be healthy, not stressed out going into surgery.
Yeah.
We want to handle the tissues minimally during surgery. So there's a lot of surgical technique involved. I'll spare you with a lot of the details. And then the closure. I close all the breast incisions in 5 layers. It's kind of like lasagna, right? 5-layer lasagna, you bring all the layers back together very precisely. Your body's like, oh, nothing happened. Like hey, you were just here, and you put it right back together, right? So it doesn't need to put out all the scar tissue to close the gap. So that's where it starts. And then the scar management protocol afterwards. So we tape all of our incisions for 6 weeks afterwards, and that prevents little micro movements in the skin so that it has time to develop that strength across. And then at 6 weeks, we start a scar gel. I recommend Scanuva. It's not my product, but I think it's the best product out there right now. Has silicone gel in it, has some fetal growth factors in it. And I think it has some lightening agents in it too to help reduce pigmentation. And that helps. We do that for at least 3 months afterwards. And then if we have to after that, we can do a little CO2 laser on top of that. And that's been our secret to minimizing scar. It's not our secret. We tell everybody. We tell other surgeons, you do this. Because, it's like the more we make plastic surgery more mainstream and less complications, the more people get plastic surgery, the more that we all benefit. And, and I feel better
it's
about
actually
that.
such a great way of thinking about it. So it's like, I respect that. What about deciding on a size? How do you work with a patient to decide on a size that works for them? Because, like a lot of the DMs I've been getting lately has been like, oh, like, just like, how did you know you were going to be happy with your size? So like, what's that process like?
So it's very patient dependent. So I ask my patient to do a lot of soul searching, and I try to keep you within a happy medium. And that happy medium is something that kind of matches your body, right?
Yeah.
I have some people that I want absolutely nothing at all. And I'm like, we really don't want that, because most of the time you don't want that. You'll end up looking like a bowling pin, right?
Yeah.
And so I try to kind of steer people, but I still will sometimes do that. And it never looks great when I do it. And these are people that are like, double whammy, I don't care. And then they end up actually happy that that is completely flat. But these are people that really, really, really want that. Okay. I know people feel like they want that when they have very big breasts and they're like, God, just get rid of them completely. Right.
Yeah.
But there is a point where you go too far, and then the grass is always greener, right? So first of all, your breasts are too big. Now they're too small. So, what you don't want is to reduce somebody so much so that then they want to come back and get an augmentation.
Yeah.
Then you're just doing 2 operations instead of 1. So it starts with the patient to do soul searching, starts with a great consultation. And then I kind of guide them about what matches their body. There's small, medium, and large about what matches their body. And I generally try to keep people within that, because we want to kind of balance the proportions that match your body. So for you, for example, I think we did a result that kind of match your goals. I think you showed me some photos, and the end result though, that we wanted to match your body, and I think we hit home run. What do you think?
it was absolutely perfect. Like I
Yeah.
knew I never wanted to, because I was a G and I never
Yeah.
wanted to go down to an A. Yeah, I know it was real gnarly. I knew I never wanted to go down to an A because I wouldn't feel like myself in my body, and
Right.
it just wouldn't look proportional either, I don't
Yeah.
think. So I was so happy with the final result that we had. And like, honestly, like I think I look great in my clothes. Like it looks right finally. You know what I mean?
Yeah.
So one of the questions I get loads is about breastfeeding.
Yeah.
Now, I think that this is actually, if you could answer about both implants and reduction, does going through like surgery on your breasts impact your ability to breastfeed in the future?
The answer is yes. The short answer is yes, and to varying degrees. If you're going to get a breast augmentation, the studies show, I don't have specific data on my patients, although I probably should try to do some data on this, but I have lots of patients that go on and breastfeed. I haven't had anybody come back and tell me they haven't been able to breastfeed, but that's not statistically significant because I haven't been doing a study and I haven't been polling all my patients. Nationwide, there's studies that range from anywhere from 7 to 15% of women who get breast augmentation report difficulty breastfeeding. And that means that they can't.
7 to 15% isn't a large population, though.
It's not a huge percentage,
Yeah.
right? So I like to think that my operation is different. I really try to preserve, if you think about the glandular structure of what a mammary gland is, it's like a pyramid. And at the top of that pyramid is a nipple, right?
Yeah.
So what you don't want to do is disrupt those ducts that are going to the nipple. So when I design my operations, I always try to minimize that impact of that pathway to put the implant in to avoid the majority of the mammary gland tissue. When it comes to breast reduction, we're actually taking mammary tissue. But the good news is you have so much of it. It's like, okay, we have probably 7 times the amount of mammary tissue that we actually need to successfully breastfeed.
Dear Lord, okay.
Right? Like for a G, you could breastfeed a small village if you wanted to. You know what I mean? You have like powerhouse. You could basically you have the ability to like squat 2,000 pounds with your breasts is basically what you have with G's, So it's just like, because you look at some women, they're A cups and they can breastfeed fine. Isn't that crazy?
Yeah.
What the human body can do. And then they upregulate and they can control it. So when it comes to the resection pattern for a reduction, the statistics say that it's about 40% reduction in ability to breastfeed for breast reduction. Okay. And that varies, depends on what kind of study you want to do. So if breastfeeding is the most important thing in the world, I recommend that you don't have breast surgery at all, because then you just don't have to worry about it, right? Go have your kids breastfeed and then do it later. But conceptually, when we do a breast reduction, we're taking kind of a quadrant of the breast. We're taking the lower quadrant of the breast. And I really try to not mess with that apex going into the nipple portion, so that there's always a connection of some glandular tissue connected to that nipple so that there is an ability to breastfeed afterwards.
Very cool. So also something that I want to discuss is the fat transfer procedure that we did for my boobs,
Exactly.
right?
And that was a nice touch.
Yeah. So, I wanted a little bit more fullness at the top, but I wanted to kind of do that without implants if possible, which is kind of what we did. So what is the difference between implants and fat transfer if someone doesn't know?
Well, breast implants are made typically now of cohesive silicone gel. So it's gummy bear. They're very safe. They're very inert. They tend to hold shape very well, much more so than fat. Fat's kind of liquid. You put it in there and it kind of fluffs an area up, but it doesn't have any kind of like shape defining characteristics. So it's great for this procedure because when we do a lift associated with our breast reduction, there typically is a tiny bit of flatness at the top part of the breast. So you get this kind of this shelf appearance. So what we do is we take a little bit of fat that we already harvested from that lateral part of the breast, and we put that right at that top portion. So you get this perkiness, this more of this kind of teardrop shape that starts and it gently goes down to the breast. So we find that that's like a win-win because we're taking fat where we don't want it. We're putting it where we do want it. And then we don't have to use an implant, right? For people that really want that pop and that perkiness, an implant's the way to go. And then that's always going to really just be that high, pronounced, perky look at the top. But of course, there's complications associated with that. It's a much harder operation to do. And so most of the time, I just recommend it if we need to in a certain situation, just put a little bit of fat there. Most people are happy with that.
So actually one interesting question that I kept getting is when it comes to armpit liposuction.
Yeah.
And what's really...
Sounds so sexy.
Truly. Just could there be a sexier
I'm here for my
procedure?
armpit liposuction.
But it's really interesting because this was a problem area for me for an eternity. I had never in my life worn a tank top, tube top, nothing, because it was like so problematic. Obviously, like I had to consider the bra anyway, but like on top of that, there was like a little pouch of fat. So how common is armpit lipo? Is it more so an issue that you see with women with bigger breasts? What's the deal there?
Yeah, you nailed it. So women with larger breasts, they typically have more armpit fullness, and that could be fat, or that actually can be axillary breast tissue. It can actually be real breast tissue that extends in a tail pattern into the armpit. So we have to, that's when we did a good exam. I pinched it. I was like, all right, this is just a little bit of fat. And it generally happens with people that have larger breasts. And so that's why we do that liposuction in that area to kind of take care of it. And then in certain situations, if it's actually glandular tissue, we need to remove that tissue, and that can be done through direct excision, or now lately we've been doing an endoscopic technique so that you don't have a big incision in your armpit.
There was nothing for me.
No, well, you didn't have glandular tissue, but you had fat. So we
okay,
just took the fat. Yeah. That way we avoid any scars in that area. But it's a game changer, right? So it's about the bras and the clothes. I know.
Huge. So then if someone like, how common is it just like, or how do you rather assess if someone has like glandular tissue or if it's fat? Like if a patient just comes in and say they have like non-G boobs, like regular size.
Well, people know, they're like, this sticks out of my bra, and you can see it. It bulges like a peach almost. And versus fat kind of holds its fullness all the way down, but like glandular tissue will bulge distinctively. And then the sure way to tell is by exam. If you pinch it, glandular tissue is firmer. Like if you pinch your breast, it's not fat. It's like there's firm tissue there. If you pinch your butt, it's fat, right? So that's kind of the difference.
And how common is armpit lipo? Or like a lot of people?
I get people that come in just for armpit lipo all the time. I have videos on armpit lipo. I had a German TV pick up armpit liposuction from me for whatever reason, and now I get a lot of people for armpit liposuction. Like it's just with breast reduction or just in general.
Wow. And what's the recovery like?
Soreness. Like for you, when we did your breast, we did your entire breast surgery, and then we did that liposuction in the armpit. You probably had the most amount of pain just in that area. What
it felt like I'd done like 100 lat pull downs. That's how I explained it. I was like,
have you ever done 100 lat pull downs?
No, but I've done like 20, and I've been like, it was like the same, but like way worse than that sort of,
Yeah, no, that's what I tell people. It's like, you're not going to feel much from the breast. Breast is going to feel relieved because you finally lifted this burden. But you're gonna feel this liposuction result. It feels like you did a lot of big workout. It's not like this excruciating stabbing pain. So
no, it's
very
really not.
Doable.
Yeah, 100%. So I know that you are like, I'm sure that you've seen, and like most people who are listening have heard about the whole Bella Hadid coming out about her nose job, right?
Yes.
And I mean, obviously she's had it for a while, and she came out and talked about it more recently. But how common is it for celebrities to be getting procedures done without us knowing about it? And the reason I ask this is because these women are absolutely stunning and like, like just flawless. And, I think that there are certain, like, I think people have like this false perception of like what natural beauty is almost,
I would say that 95% of all celebrities get some kind of work done.
Wow.
And it's not because they're vain. It's because it's part of the job.
Totally,
right?
yeah.
They are under the most intense scrutiny, and my heart kind of goes out to them. I have a lot of patients that are celebrities, but it's a tough world. It's like, especially for women, like how many roles exist for women who are over 30 years old? It drops off tremendously. So, but there's a catch-22, right? Because it's like, is there some responsibility for people to be honest that they had work done to get their looks this good for the general population? Because there's a large portion of people that are looking up to them as role models. But at the same time, they're trying to get that next gig to keep their career alive.
Yeah.
And they don't want to admit that they had any work done because they don't want it to jeopardize them getting that role.
What's really interesting here is that we all admit to getting eyelash extensions and facials, and like it's completely normal, or like I have makeup on my face, right? But like it's just,
so do I, by the way. I do it for the podcast.
You look great.
Yeah.
But I don't understand why there's this like almost like taboo or like hushness when it comes to getting help beyond these like, I guess like easier procedures, if that makes sense.
Yeah. I mean, that's always kind of existed. It's getting better, thanks in part to the Kardashians. But like if you go on the East Coast, nobody talks about plastic surgery.
Yeah, it's really, it's a very strange cultural thing, I think.
So you can kind of see how far we've come by just, visiting the East Coast, and then, or even New York's, New York's a little more popular, but still it's hush hush. And then coming to LA, it's very open here.
Totally.
People talk about their BBLs, like, oh, I have my BBL, I have my nose done, and they're proud of it. And you go to Rock on Rodeo Drive, which is just down there, and you'll see that people have stuff on their nose and they're just out there shopping. It's much more accepted. I think it's going more mainstream because it's becoming safer. And people are self-actualizing, and they're realizing life is short, and they want to feel good about their bodies. And I think as long as it's safe, it's something to be proud of.
Yeah, I couldn't agree more.
Yeah.
Last question before we actually go into rapid fire is,
nice.
What are some plastic surgery trends that you're seeing?
I think with the whole pandemic, there's been a large focus on facial aesthetics and like neck double chin aesthetics. So I'm getting a lot of people that are coming in because they have tech neck where they've been hunched over, or they feel like they have a double chin. So we've been doing a lot of neck liposuction, chin implants, people's appearance and how they look on Zoom.
Wait, what does a chin implant do?
So it's interesting. People feel like they have a lot of fullness in their neck, but they actually could just have a hypoplastic chin, meaning that if your chin is retrognathic, meaning it's too far back, your neck can look bigger than it actually should. So if people come in like, I need neck liposuction, like, actually, we could do a little neck liposuction, but what we really need is some projection in your chin. And so there's a book I recommend you read. If you're into some of this wellness and natural stuff, it's called Breath by James Nestor. And he talks about
I'm gonna write that down.
How kids are given soft foods and they're bottle fed and they're not breastfed, and so their jaws are not developing like normal. And when the advent of soft foods and food, processed food and farm food came out, that's when people started having bad teeth and all this other stuff. I know I'm going on a tangent, but if you want to avoid your kid from having a chin implant, breastfeed them and give them solid food to eat on.
That is really fascinating.
Soft baby food, all that stuff just stops the stem cells from kind of delivering to the jaw area, and you get less jaw growth.
Wait, is this book also the one where he talks about the importance of breathing from your nose?
Yes, that's his main thing, right?
Okay,
so
okay.
So like I do some crazy stuff now. I take my mouth shut at night, so I breathe through my nose exclusively.
Yeah, I actually want to try. I mean, I'm not a mouth breather to begin with, but
Yes.
I want to really optimize that as well.
Yeah, breathing is very powerful. You got to read his book.
Okay, I will definitely be into it. Okay, so then you have the chin implants, the neck lipo, anything else?
Nothing on top of that. Some ear surgery. So people are noticing prominent ears.
Really?
Yeah.
Wow,
we're getting
that's
uptick of that.
fascinating.
Yeah, I know. So a lot of facial related stuff.
And what about the lips? Because this was like a big thing. Do you see it fading a little bit more?
A little bit.
On?
Kylie's kind of backed off, and I'm thankful because she's more into the natural look. She got them dissolved, and she came out and admitted finally, okay, I have my lips done, And so I think people are going more into kind of some natural looking things, which I think is good. So thanks to her.
Yeah. I mean, people. I see that as well. So, okay, to end the show, I want to do a quick rapid fire round. So, first one, what is one big dream you had that didn't work out? Or did you always know you wanted to be a surgeon?
I wanted to be a paleontologist when I was a kid.
Wow, very cool.
I wanted to study dinosaurs, and I'm still fascinated by dinosaurs. I read my kids' dinosaur books, and I secretly do that so that I can learn more about dinosaurs.
Like Ross from Friends.
Yeah. Pivot. You guys remember that episode?
Yes, so good.
And then I take them to museums, and they like dinosaurs too. So
maybe one of them will be a paleontologist. Who knows?
Maybe I just live vicariously.
What is one wellness hack that you love?
I have this ring. It's called the Aura Ring, and it tracks my sleep. It's probably the single most important thing you can do is actually figure out ways to get better sleep at night. So whether you get rid of all this screen time right before bed, you get rid of any of the red lights or little dots from like electronics, you shut off electricity in your room, you turn off the Wi-Fi, all of that can be kind of tracked with this ring, this Aura Ring. And I don't have any stakeholder in it, but it gives me a little summary of my sleep every morning, which I think is very important so that I can figure out how to optimize my sleep every night.
Very cool.
Yeah.
What is one book you recommend everyone reads?
Well, we just talked about it, Nestor, but I'll tell you another one. If you can't read Nestor's Breath, Wim Hof Method by this guy, Wim Hof. He's all into basically cold therapy, taking cold showers, the benefits of that, which I actually recommend to a lot of my patients to do prior to surgery. So it helps them with pain control afterwards, helps them with anxiety and so on and so forth. Great. All right. So that's it with our guest, you guys. Siff. Siff, is there anything you want to tell the viewers out there that we didn't get to talk about?
Go to Dr. Barrett.
Okay. What's one thing? Can I ask you a little quick
Yeah.
rapid fire? What's one thing that surprised you most about this whole process for breast reduction?
How easy it was. I never in my life expected that after week 1, I'd be like out and about. Like, I mean, I was going out. I'm just past week 2. I'm out here like interviewing you, like going out on long walks, wearing whatever clothes like it's crazy. I would have never in my wildest dreams imagined how quick recovery is.
Well, I think you're also an incredible person. So that's wonderful. And you have a little bit of advice that you could recommend to someone who's thinking about getting breast reduction, besides coming to see me.
If you've been thinking about it for, I would say, more than a year, I think it's time. Like I think it's funny because I apply this to my life where like either I can't just sit there and complain about something, right? Like either I change it or I live with it and learn to live with it happily. But I never thought that way about my breasts, right?
Yeah.
Like I'd been complaining about it or like had like I was just annoyed with it for so long, but I just chose not to change it and or live with it, but more so like complaining about it. So I feel like if someone is bothered about something for over a year, you probably should come see someone.
Yeah, I agree with that too. And what's one of your like wellness tips, hacks that you
Oh my
like?
God, so many.
I know, it's hard.
It is really hard. Honestly, I would say sleep as well. And like the easy way without an Aura ring that like if someone doesn't want to get an Aura ring is probably to sleep at the same time every night if they can, because
that's
it's
really
the
good.
easiest way to like,
And wake up at the same night too.
Exactly.
Yeah.
Same time. And actually there's a great book. I'm not sure if you've heard of him, but on Instagram, he's a sleep doctor. I think you'll love his book. It's called the Sleep Archetype book or something like that. I'll send you the name, but it's an incredible book.
We'll put the link in the comments in our podcast.
Yeah, it's amazing.
And then lastly, how can people learn more about your company and your products?
So you can find us at arrae.com or on Instagram at arrae.co. 100% natural. We use really highly active, potent ingredients. Everything is formulated by doctors. We actually just ran third-party clinical trials as well. So,
wow,
yeah.
That's really hard to do.
It is so hard. It took us like a year and it was very expensive, but we're really proud of the results.
Amazing. All right, so we'll put that link in our show notes as well. Siff, thank you so much for being on the show, and I'm happy to be on your show as well.
Thank you. This was a joy.
Amazing.